All right, let's dive right into this. In this explainer, we're going to take a fascinating journey inside our own arteries. We're looking at how a seemingly simple, quiet fatty plaque can suddenly escalate into a massive, life-threatening medical emergency. It's basically a biological chain reaction, right? And it happens inside millions of people. Understanding exactly how this works is absolutely critical. So let's get into it.
Here's our roadmap for today. We're covering 4 main stages. First, stable angina, the warning. Second, nitroglycerin, the first defense. Third, unstable angina, the rupture. And finally, NSTEMI versus STEMI.
Starting with part 1, stable angina, the warning. This is where our journey begins, with a condition that's strictly driven by physical or emotional exertion. To really wrap our heads around this, I want you to imagine your artery is a super busy highway. Now this fatty plaque, it acts like a massive physical roadblock that's narrowing down the lanes. But it actually does more than just take up space. It changes the blood vessel itself, making it incredibly stiff. Normally, when you exercise or you get super stressed out, your heart demands more oxygen, so your vessels naturally widen or vasodilate to handle that extra blood flow. But because of this plaque, the artery simply can't widen. It literally cannot handle the extra traffic. And that lack of oxygen-rich blood reaching the heart muscle, that is exactly what triggers that classic chest pain.
Now, the predictable nature of this early warning stage is brilliantly summed up by what we call the 4 S's. First, you see it coming. Patients usually know that, say, walking up a specific flight of stairs is going to trigger it. Second, it's short-lived. We're talking 15 minutes or less. Third, it stops the moment they just sit down, rest, or take their medication. And finally, it's all caused by those stiff arteries. So at this stage, the plaque is relatively stable. It's basically your body's early warning system screaming that the highway has reached its capacity limit.
When we check out the diagnostic biomarkers, the good news is there's no permanent heart muscle damage just yet. That's exactly why the troponin levels, which is a protein released into the blood only when heart muscle dies, well, those are completely negative. And if you run an ECG while the patient is just chilling out, resting, it's going to look perfectly normal. But if you look at that same ECG during exertion, boom, you get a massive clue. You'll see ST depression and inverted T waves. This is basically the heart telling us that ischemia, or restricted blood flow, is actively happening the second the heart gets stressed. So how exactly do we treat this warning sign? That brings us to section 2, nitroglycerin, the first defense. Let me tell you, this medication is an absolute game changer. And here's a crazy fun fact for you. Nitroglycerin is the exact same chemical compound they use to make dynamite. No joke. But here, inside the human body, instead of blowing things up, it rapidly expands the blood vessel. Since it's a super powerful vasodilator, it basically forces our narrowed, stiff highway to open right up. This immediately clears out that traffic jam of blood, allowing oxygen to just rush back into the starving heart muscle. Now, using this requires a very strict clinical sequence. It essentially starts the ticking clock. The protocol goes like this. The patient pops 1 tablet under their tongue, and then they wait exactly 5 minutes, closely monitoring their pain. If the pain is still there, they can take another, but they are strictly capped at a maximum of 3 doses. 3 and done. It's a precise protocol because, honestly, this medication is incredibly potent. If this whole thing is unfolding in a clinical setting, let me tell you, during this tense waiting period, you are absolutely glued to the monitors. Why? Because nitroglycerin opens up vessels system-wide, which means it can cause the patient's blood pressure to just plummet. You have to make absolutely sure that systolic blood pressure doesn't drop to a dangerously low level. And at the same time, you're watching the ECG like a hawk, hunting for any ST segment changes that might hint the heart muscle is actively dying.
But this brings us to a really terrifying turning point. What if those 3 doses of nitro just don't work? What if the pain just doesn't stop? Well, that means our relatively stable, manageable situation has violently shifted.
Let's move right into section 3, unstable angina, the rupture. In the medical world, they ominously call this phase pre-infarction angina. This timeline vividly maps out the sudden, catastrophic deterioration inside the vessel. Out of nowhere, that stable fatty plaque completely ruptures. The body panics, thinks there's a huge bleed, and sends platelets rushing in to save the day. But actually, scratch that, they aren't helping at all. Inside this tiny, already narrowed space, those sticky platelets clump together and end up causing a massive, disastrous multi-car pileup. In that multi-car pileup forms what we officially call a thrombus. It's basically a growing physical roadblock right there inside the artery. Now, unlike stable angina, where you only get pain during a jog or some stressful event, this thrombus is actively choking off the oxygen supply to the heart, even when the patient is just sitting on the couch, completely at rest. It's a huge problem.
So now, we trade our 4 S's for the 4 U's, which really highlights the intense danger of this escalation. First, it is unexpected. Like I said, it happens right there at rest. Second, it's unaltered, meaning taking a breather or popping a nitroglycerin absolutely will not touch the pain. Third, it is unrelenting. We've crossed that crucial 15-minute threshold and the pain is just building and building in a crescendo. And finally, it comes with what we call unbelievable symptoms.
And these unbelievable symptoms, they should be setting off every single alarm bell in your head. We're talking severe shortness of breath, cold sweats, intense nausea, and this very distinct, overwhelming feeling of impending doom. Now, this is absolutely crucial to remember. Symptoms can be highly atypical, especially in women. They might not even get that classic Hollywood-style chest-clutching pain. Instead, they might just present with extreme, unexplained fatigue, so you really have to be paying attention.
As that clot continues to gather more platelets and grow bigger, we enter our final phase. Section 4, NSTEMI versus STEMI.
All right, let's compare these final 2 stages. With an NSTEMI, you're dealing with a partial blockage of the artery. There's no ST elevation on the EKG monitor, but those troponin levels in the blood, they're finally elevated, which means heart muscle cells are actively dying. But a STEMI? Oh man, that is a 100% complete blockage. The troponin is sky high, the ST segment is elevated, and that heart muscle is literally facing irreversible death. Now, for an NSTEMI, the medical team is in an absolute race against the clock. They've got to clear that highway before it closes up completely. They'll use some pretty aggressive interventions, right? Like a continuous nitroglycerin drip to try and force that vessel open, a heparin drip to stop the clot from getting any bigger, and antiplatelet therapies like Plavix to keep those sticky platelets from piling up any further. And a lot of the time, they're prepping for a heart cath to get physically in there and see exactly how bad the damage is. But a STEMI? That is the ultimate, absolute worst-case scenario. When you see that ST elevation pop up on the monitor, it is practically screaming at you that a huge section of the heart is completely starved of blood. At this point, IV drips just aren't going to cut it anymore. The patient needs structural intervention, like right now. That means rushing them straight to the cath lab to insert stents and physically prop the artery open, or if things are really bad, going straight to open heart surgery. Let's lock all of this in and look at the big picture. Notice how these metrics escalate as the heart muscle literally marches toward complete starvation. Look at the troponin. It starts off totally negative with stable angina, right? But the second actual cell death kicks in during an NSTEMI and a STEMI, it flips to positive. And the ECG? It goes from only showing changes during a tough workout to throwing massive permanent ST elevations during a STEMI. It's a terrifying progression for sure, but as you can see, it's also entirely logical. Ultimately, understanding this biological escalation, how we get from a simple, stiff artery to a massive, life-threatening heart attack, is what saves lives. This isn't just medical trivia. We're talking about the actual timeline of human survival. Knowing how incredibly silently this cascade can begin, it really leaves you wondering, what subtle signals might your own arterial highway be sending you right now?